I'd gone in for an annual physical with my primary care physician.
Mike had a history of known coronary artery disease. He had had a remote heart attack, and his primary care physician heard an abnormal sound in the neck, suggesting blockage in the neck artery.
On the left side, he had noticed the sound was irregular.
And he was referred for an ultrasound in our office. At the time of the ultrasound, they found a critical blockage in the left carotid artery.
The blockage was significant, and the pressure through there was high enough so that I was at severe risk for a stroke or something really bad to happen.
We were able to enroll him in a clinical trial assessing carotid stenting. He had a carotid stent deployed in the left carotid artery.
And went into the hospital on a Tuesday and was out by Thursday, as I recall, and back at work on Friday.
And he's now 2 years out from that procedure, doing very well. As I move forward, the stent starts here and it comes all the way through here. So here's us moving forward up that carotid artery as we go up your neck, and we look at it in segments, take it in pieces. And there's the leading edge of the stent that we saw before. And see how the flow through here is smooth, there's no turbulence.
I feel like it was a real possibility that had they not acted fast, I would be dead or I'd be drooling. One of the two right now are just debilitated as a result of a stroke.
This is the kind of imaging that, with the current proposals, will go away. Imaging technology such as this is one of the things on the chopping block with new reform and proposed legislation.
I think that policymakers need to look very, very hard before messing up a system that works really very well.
Taking off an additional day of work for a diagnostic test at the hospital and then seeing the physician at a later time would slow access to care. Getting clearance for such an imaging test from an outside party before seeing him in the office would slow access to care.
I think it would be disastrous to do that. You have so much more just bureaucratic mess. If you move it, say, to a hospital or regional hospitals, rather than have the very person that does the diagnosis and the expert that's there being able to act quickly and decisively and having the things readily available to them.
There are many situations where having the patient in your office available and having the diagnostic testing right there based on your clinical judgment to get that testing done is very important.
This is one part of the system that I think works amazingly well, that I was just almost bedazzled to see how quickly it did work and how effective it's been.